There are many ways we can treat blepharitis. Blepharitis is when the glands of the eyelids get clogged. And one of the main complaints people will have is crusting on the eyelids, or redness along the margins of the eyelids, or excessive itching with their eyelids. And the mechanism of blepharitis is that the eyelids have little holes along the margins. We call them the meibomian glands. And when those glands get clogged, either from sweating, from exercise, or wearing makeup, or just years and years of buildup, then the normal oils that are in our ducts, our meibomian glands, don't come out. So now it's warm, because our skin is warm. It's salty, because our tears have salt in them. And it's wet. And bacteria love to grow in that. So along the eyelid margins, you have these stagnant fluids full of bacteria, because we have bacteria in our normal skin, and they culture. And then as they culture in there, you get an infection that's stuck inside the gland, and that bacteria secrete waste product that comes out as crustiness, and sometimes it looks like soap bubbles when we look at the surface of the eye under a microscope. And you know, soap doesn't just come out of nowhere, it comes out of bacteria that are growing in the lids. So in order to treat that, there are many ways we can treat blepharitis. We can treat blepharitis, the first line of defense is, again, a hot washcloth with warm water on it. We don't want the water to be hot enough to burn you, but we want it to be warm enough where it can help melt some of the debris that's clogging the gland. While the washcloth is on the eyelids, we like to give a gentle massage along the eyelids to try and express the glands to get some of that fluid out of it. That technique, once or twice a day, can a lot of times can stop you from having the blepharitis symptoms. It can also stop you from having styes, which are those little bumps that form on your eyelids. Sometimes people have such severe blepharitis, inflammation of the lids, where we have to use medication to help treat it. Medication can be an oral antibiotic that kills some of the bacteria inside the lids. It could be topical antibiotics, maybe with a little steroid, or they have these new medications that are over the counter, which are fantastic, and it's made with hypochlorous acid. It's not the kind of acid that'll burn you, but hypochlorous acid is a natural component that's in our bodies which kill germs, kills bacteria. And they have them in spray form, in foam form, or they have them in form where there's a wipe and you close your eyelids, you kind of spread it on there. The best time to do that is after you use the hot compresses and it opens up the pores of the eyelids, and then you put a little of this hypochlorous acid on it and it kills the bacteria. And I think that that's a fantastic way of dealing with the problem.